years. Insurance plans need to cover 10 categories of essential health benefits. We'll show what those are. Most preventive services are at no cost to the consumer. So if you, we'll talk a little bit more about this, but if you go on to healthcare.gov, they have a list, if you print it out, it's about 9 pages of preventive services that are now covered at no cost. A whole list for individuals, and then an additional list for women, and an additional list for children. And no lifetime maximum for benefits. Eligibility for these premium tax credits. Have people heard about subsidies? These premium subsidies, not so much. Okay, the tax credits that we're referring to are these premium tax credits, are these premium subsidies. And the language is now moving to more to a tax credit because it's going to be reconciled on people's taxes. Small business tax credits are in existence, but they're going to increase next year. And large employers, 50 or greater, who we're going to need to offer qualified health plans a more robust coverage in 2014. That has been deferred until 2015. So the health insurance marketplace, we spent some time here because you'll hear about have people been hearing about the health insurance exchange or the marketplace? The marketplace, again, this is the new terminology for this health insurance exchange. And what does it actually look like? What it is it's a website, www.healthcare.gov. You want to write that down if you want to explore this on your own. And it is an opportunity right now. There's a lot of informational materials on this, but very shortly, October 1, you're going to be able to actually go on a single online portal and check out your ability to get coverage for a number of things. So you're going to be able to see if folks are going to be able to see if they're eligible for Medicaid, MaineCare here in Maine, or the Children's Health Insurance Program. They're going to see if they're eligible for these premium tax credits. If they're not eligible for tax credits, they're going to be able to look and compare plans that are on the marketplace for unsubsidized exchange coverage. But one of the things this is going to allow people to do is at one site determine there will be people who find out that perhaps they didn't know that they're going to be eligible for MaineCare, perhaps they didn't know that their children were eligible for the Children's Health Insurance Program. They're also going to be able to find out not only if they are eligible for the premium tax credits, but if they're eligible for cost-sharing reductions as they utilize their health care. And we'll talk about what that means. And information is going to be available. People have compared when you start and you go on to the marketplace. And again, it's not operational until October 1, but it will be like more of a TurboTax. Whatever you answered previously is going to affect your next field. So if you say, I'm going to cover myself and a few dependents, they're going to keep asking you to fill out the forms for those people that you've mentioned. If you say, I have a job, they're going to want to know about income. If you say, I have health insurance right now, they're going to know what it looks like. So you're going to be filling this information out. When you get to the point where they determine if you're eligible for subsidies, and we'll talk about how they figure that eligibility, it's then going to move to something that feels like Expedia. Okay, so you're going to have 2 insurers who are on the health insurance marketplace for these individual plans and these small group plans. Mostly I'm talking about individual tonight because I'm thinking that a lot of people in the community might be, in fact, looking at insurance for themselves or their families as opposed to large groups, small groups. So when you get to the Expedia part, right, it's going to have Maine Community Health Options plans listed. You're going to have Anthem's plans listed at different levels of coverage. And you're going to be able to do some real comparisons because we have submitted our information, as has Anthem, with these fields and these templates so that it really facilitates people looking at things and making some comparisons. And that was the idea.